Good evening, everyone. Thank you. Be so patient to wait so long at the end of the sessions. I would like to talk about the binary medical lasers. It's a pretty new name, binary, but lasers. But everybody probably know about the binary effects in military. If you shoot one shell, nothing happens with the wall. If you have a binary system that it has twice more, 3 times more energy, it allows penetrate anywhere you want. Or let's look at the how doctors trying to destroy during the procedure with ultrasound the stone. One doesn't work. If it's several of them, then it's accumulate energy and push it down. What happens, it was a lot of discussions why the sequential or one laser after another doesn't have effect when you do simultaneous. What happens with the simultaneous delivery? It's turned out when you have one wavelength, it's penetration. I will be talking about the 1550 and 1927. And penetration from the, I want to mention, penetration from the erbium glass and diode 1550, it's different. Effect from the thulium laser 1927 and effect from the diode 1927 is also different. Because it's one that delivers spikes, another delivers very smooth way, and heating, of course, is different. What happens when you deliver simultaneously 2 wavelengths? Let me, oops. Oh, I'm unsuccessful. This one. Okay, I don't need, yes, okay. Okay, this is the most important slide I try to explain. If you deliver one wavelength, oops, I have to change glasses again. It's different computers. Okay, if you look at the depth of penetration of 1927, we're talking about 150 microns from diode laser. If you look at the 1550, 250, 200, 300 microns. But what happens if you deliver simultaneously? It creates double energy cloud. And is this cloud like an oven? You heat something, and then you open door, and all heat shock waves going down, pushing the longest penetration wavelengths from 300 micron to almost 1,000 micron, 1,500. It means millimeter and a half. And then 1550, never been at this depth. And we clinically, I'm a physicist, but also I'm a surgical oncologist. I could tell that clinically, I've seen the effects which I supposed not to see with 1500. When I first time brought idea of the fractional laser 1550, and we try everything, and it's turned out that never, for example, treating tattoo. But when you push down with a shock wave energy through the reticular, through the papillary dermis to reticular dermis, you see unusual effect. And this is unusual effect. It's not optical penetration. It's thermal penetration, but created effect by 1500, which is pushed down with this I already told, this cloud. It's just theoretical discussion, but we decided to check it. Before abdominoplasty, we choose squares. Just let me move. We choose different squares with a different effect. In one case, we use only 1927. In another case, different energy of 1550. And then sequential, also one after another. And the third, of course, the last one was the binary effect, combination of. And then, after the abdominoplasty, we take the skin and send to histology to understand what happens with tissue, how it was affected, this energy cloud, and where is the binary effect histologically, in order to show people, to doctors, I will not trust until I see histology and I see, yes, I understand that there's something going on much deeper than usually I have seen from 1500. And this is a table showing how we did study. I don't want to very much stay on it, but it's look at the, oops, maybe too much. Look at the 1550, 40 millijoules. It's average energy for pulse for 1550 diode laser. And if you look at the scale, it's true, 1550 goes 250, 300 microns showing the damage. And in order to prove it, of course, we did different staining. And you could see, again here, depths 250, probably 300. This is 1927, very superficial. You see the scale 100 micron, and depth is a little bit deeper than 100 micron. Here is deeper than 100 micron. And if you look at the comparison, of course, one is 300, another 150, as I explained before. What happens with the sequential? Sequential a little bit deeper, because you, as the previous report was saying that if you vaporize a little bit water, the penetration and other wavelengths follow would be a little bit deeper. But again, look at the depth. Yeah, it is deeper. Instead of 150, 1927 followed, and 300, it's a little bit, probably 350 up to 400 microns penetration. And then it's different staining. It's very clear that it works and it goes at this depth. Then we changed the 1927 50-50. Oh yeah, the difference not big. Which one you use first? Of course, the vaporization of water helps another wavelength penetrate a little bit deeper. But this is the sequential comparison if 1927 50-50 or 50-50 1927, not a big difference. Let's see what happens, as I told, about the thermal shock wave. And when you create a cloud, and this cloud creates a lot of energy at the top, and it's pushing 50-50 to the level of, if you look, 500 micron scale, and it's almost 1.5 millimeters, which you never expect to have from 1550, and also, of course, let alone about the 1927. One of the effects also we have understand fiber glass, that's erbium glass laser or thulium laser. They spike and they don't have frequency delivery through milliseconds to the skin. This is why this is a heat shock wave, has the same speed as you have frequency of around 8 milliseconds when you deliver energy. And this is very interesting phenomena. You never expect, if you radiate with this 1550, you never see this depth of penetration. And of course, as we try to compare with the frac cell and treated all potential pathologies, but what is most interesting in this pathology, as I mentioned before, we never treated some indication that we were able to treat with this device. And we created a laser. We have a laser which is, we created a laser which replaced erbium glass and thulium laser with very powerful, today in the military, very powerful diode laser, 2 to 3 millimeters, which doesn't require a lot of power supply. And in all existing today in industry, lasers allows to build handheld, but much more powerful. When I build fractal dual, and then with the fibers, and then with diode lasers, the difference in weight, for example, 16 kilos or 300 grams. 300 grams device you could put on the belt, and you could use it. You don't need plug-in power supply, because in all flying machines today and so on, for rangefinders, you don't need a lot of power plug it in. It's battery operated. And I have a battery which allows me to work all day with much more power than Fraxel Dual, and have some treatment, like from 1-2 treatments, I could treat stretch marks. I would be able to treat, I do, with this diode laser, you could change spot size from 2 millimeters for 10, 14 millimeters. You could change the space between dots, and you could change ratio between wavelengths.
You have to hurry. We're getting out of time. We have to hurry.
Okay, and it's. I want to tell that it's whole technology today. Why we don't use today huge computers? Because our iPhone is much more powerful and so on. The same with the lasers. Oops. The same with the lasers. They shouldn't be big boxes. They should be light, much more powerful, and you could carry in the pocket. And if you not plug it in, it from class 4 goes to class 2. And that's it. Thank you very much. Sorry
Thank you. Thank you very much, Dr. Tankovich.